Next we have Dr. Pavitra Patel Balakrishnan, and she is a consultant at Saideep Clinic, and she will be telling us about mapping out before you start and the role of epithelial mapping for a refractive surgeon.
Thank you, Dr. Rohan. Thank you, Dr. Nikhil, for making me a part of this wonderful instruction course. So, good morning, everyone. The topic for my today's presentation is role of corneal epithelial mapping for a refractive surgeon. So, epithelial thickness mapping was FDA approved in the US in 2017, but awareness about its utility and in some minds its necessity was still growing. So there are multiple devices now available in commercially which are OCT based and which will not only measure the epithelium but also map the epithelium of epithelium. So of them, I'll be talking about two of the machines with no financial interest here. The first one is the OptoView, which is a spectral domain OCT and the first FDA approved non-contact quantitative measure of corneal epithelium and the stroma, whereas the new Revo FC Optopol has a AccuTrack, which has a real-time hardware eye tracking, which is an all-in-one OCT. Now, typically, the epithelium thickness will be 10% of the pachymetry, which is a thumb rule that we have learned. But it could be variable in different ocular conditions. Now, normally the epithelium is significantly thicker inferiorly than superiorly and significantly thicker nasally when you compare it with the temporal epithelium. And it has a larger infero-superior difference than a nasotemporal difference. Now, according to the published literature by Dan Reinstein and group, when we look at the average pattern, there was a difference of around 6 microns between the superior and the inferior mean thickness, and there was around 1.2 micron difference from nasal to temporal region. So this is how the printout looks like for a normal epithelial map. The reliability rating here, it should be green and it should be good for the scan to be reliable. Now at the top we have the pachymetry maps for the right and the left eye, and at the bottom we have the epithelial maps. Now we have a color scale here at all the 4 areas like any other scan. Here green color is normal, red color signifies thickening, and more you go towards the blue, it signifies thinning. Now it gives us the corneal power, the pachymetry values and epithelium thickness in different zones. So this mapping is done within 6 millimeter zone, but now with modified RTView, it measures epithelium also in within a 9 millimeter zone, which of course has an advantage of a better resolution. So this is the print of a Revo FC Optopol epithelial map readout. The only difference here is that the Optopol machine scans the cornea in central 7 millimeter zone. Now, the knowledge of epithelium thickness distribution patterns may be crucial in deciding whether or not to operate the cases with suspicious topographies. This is because the epithelium is not evenly distributed over the Bowman's layer, and it is often non-homogeneously thinned, masking the underlying stromal abnormalities. So let us discuss a case example. Now this patient came for a refractive surgery opinion. He had a moderate myopia of around minus 3.5 diopter sphere with a minus 1 diopter cylinder, and topography was normal as you all can see here. And on doing the epithelial mapping, we came across a very thick epithelium of around 84 microns in the right eye and 78 microns in the left eye. So this patient had both the options of either undergoing a trans PRK surgery or undergoing a femto-LASIK surgery. But now if we had done the epithelial mapping and patient had if we had not done the epithelial mapping and if patient had opted for a trans PRK surgery, we would have used a value of average of 50 microns for this patient, and here under correction was inevitable due to the lesser stromal ablation. Because of the thick epithelium. Now, if we had planned a routine LASIK for this patient with a standard flap of 110 microns, again, under correction was bound to happen. Therefore, one needs to customize a planning for these patients, and this particular case emphasizes the role of epithelial mapping as a part of routine preoperative workup in refractive surgery patients to avoid under or overcorrection. Now, this again was a routine patient who had a IOP of 24 and 25 in the right and left eye respectively. We looked into the pachymetry reading and we got an incidental finding of epithelial hypertrophy for this patient. Also, this patient had a grade 2 nuclear sclerotic cataract in both the eyes. So if at all, leaving the IOP aside, but if at all the patient was planning for cataract surgery, treating the cause for epithelial hypertrophy, be it dry eyes, prior to the surgery will help in optimizing the cataract lens power calculation. Now, this is a published literature from Dan Reinstein and group who have beautifully described various epithelial thickness profiles for the diagnosis of keratoconus. Now, just for the ease of understanding, I have put few images here. This is the axial map and this is the epithelial map. Now, in the axial map, we should be looking here at the steepest point on the cornea, and then at the same point, we should be looking at the epithelial thickness mapping. Now, we can see the epithelium has thinned out in that particular area. Also, in this second scan, as you can see, we should be also looking for the compensatory epithelium thickening in the opposite side, like seen here in this image on our left side. Now, also here on the right side, we can see here, this is a typical donut pattern wherein the epithelium thickens in a ring manner around the thinning, which is seen usually in advanced cases of keratoconus. Now, this particular case is not directly related to epithelial mapping, but it's a very interesting case for discussion. So, this particular patient had a scarred bullous keratopathy since many years. And as we can see here, the central corneal thickness was around 750 microns and there was very irregular epithelium. So this was the fluid-filled cavity which was seen on anterior segment OCT. It covered an area of almost 197 microns from the epithelium. So we planned to do a PTK of around 200 microns for this patient. It was like a therapeutic PTK mainly to relieve the pain and by regularizing basically the corneal surface. So we had planned a ablation for this patient for about 200 microns. Cause the lower limit of the lower margin of the fluid-filled cavity was at 197 microns. But because the scarring was diffuse, we wanted a 6 millimeter optical zone for this patient. And the moment you keep the optical zone as 6 millimeters, the maximum ablation that you can do at a time was only 50 microns. So therefore, we did 50 microns of ablation 4 times for this patient. Now, this was the thickness mapping at immediate post-operative period, which showed 460 microns of central corneal thickness. And we can very well appreciate the smoothing of the anterior stroma and the fluid-filled cavity, which is not seen anymore. So this was again the anterior segment OCT. Now again, same findings, but this patient had deep stromal opacities here, which we can see clearly. Now, this was the 1 week epithelial thickness and the pachymetry mapping, which again showed which basically the patient was maintaining the corneal thickness of 469 microns and the epithelium had started to regularize. And this was the 1 week ASOCT. Now, the next case is basically epithelial mapping also has a role in patients who have undergone LASIK surgery. So, as we all know that the corneal epithelium, it thickens centrally and paracentrally after myopic LASIK, as can be very well seen in this scan. So, however, the extent of epithelial remodeling correlates with the amount of myopic LASIK correction done. So, to summarize, epithelial mapping will definitely change the way we assess the cornea. It has invaluable role in refractive surgery, pre-refractive surgery evaluation and also complications. Also, when you land up in refractive surprises, you might want to look at the epithelium to rule out ectasia. It also helps us to monitor pre and post cross-linking outcomes apart from detecting subtle cases of form thrust keratoconus. And it has a lot of other applications like giving us information of ocular surface health, and also it helps in optimizing the IOL power calculation for these set of patients, and especially when you are aiming for good quality of vision. And lastly, it can also help in monitoring the treatment in orthokeratology.